As soon as next Friday, some Oregon counties could take a major step towards reopening. Local public health departments met with state officials today to try to get a better understanding of the requirements that they need to meet to enter the lower risk category of restrictions. We wanted to know, how close is Multnomah County to reaching those goals? Fox 12's Brenna Kelly got some answers from the county's public health director.
Well, there are two parts to meeting the governor's local targets. A county must vaccinate 65% of adults with at least one vaccine dose, and it must submit an equity plan. I'm told counties were notified ahead of the announcement, but not by much, which for some counties means pulling together an equity plan in just a few days. Oregon Governor Kate Brown outlined clear goals Tuesday for the state and counties to reach in order to reopen the economy. Local targets for counties include submitting an equity plan and vaccinating 65% of adults with at least one dose in a given county before they can move into lower risk. Two counties have already vaccinated more than 65%, Benton and Hood River. Benton County intends to submit an equity plan by Friday, meaning they should move back to lower risk by May 21st. As of last night, Hood River's public health officer said the county will likely submit theirs by Friday, too. 4 counties, including Multnomah and Washington, have vaccinated more than 60%. For Multnomah County, that means about 11,000 more people to go, which its public health director, Jessica Guernsey, says likely won't happen this week. She says throughout the whole pandemic, Multnomah County has centered its response around the impact on communities of color, and they're hoping to reflect on the work they've done before submitting a plan.
A lot of the work that we've done is a good foundation, but looking at our numbers, we have an opportunity to really refresh our strategies and work with community partners and health systems to make sure we're actually reaching the goals of closing the gap on those vaccines.
Guernsey says some of the practices they've focused on so far includes working with culturally specific community-based agencies and creating community-based sites, incorporating staff there that mirror the community in terms of lived experience, identity, and spoken language, and ensuring materials are available in dozens of languages.
It's both about access, but really integrating these practices that we know are going to be absolutely key to ensure that we're reaching people who still need to get vaccinated.
And Guernsey says as the All for Oregon Convention Center mass vaccination site ramps down, they'll be able to redirect many of those doses to healthcare systems and community-based sites in this next phase of vaccinations. She tells me she's not sure when they'll submit their equity plan. Live in studio, Brenna Kelly, Fox 12 Oregon.